Well, everyone, today we continue our material. The previous one was about receiving patient, but now we come to the next stage of the material, that is the presenting complaint. Let's begin with the discussion. Because it is not a live meeting, so the discussion can be done after you watch this material, and you can do it with your friends after watching this material. So do you have any opinion on doctor-centered and patient-centered approach? If you say yes, maybe you can answer the next question: which approach do you think gets the best results? That's about the discussion. You can answer it with your friends after watching this material. But to bring you clear information about the patient-centered, even though we have discussed it previously in the class in the offline meeting, but better for you to study the following text. Here, there are three passage or three paragraphs in this passage. So in each paragraph, there is a gap or a blank part. So the blank part should be fulfilled with the correct sentences or related sentences that match with the content of the paragraph. After you see the paragraph 1, 2, and 3 here, you will see the four sentences that may be related to the paragraphs, but you must be careful. There are only three gaps in the three paragraphs. It means there is one sentence that cannot be put in the paragraph. So you must read the sentence carefully and then read the paragraph and then find the matching sentences that can fill the gap. That's the information that you need to know related to the patient-centered. Okay, let me show you. This is the paragraph 1. There is a blank part here that you need to fill with the sentences that correlate or match with the paragraph. And then the second paragraph is here. There is the blank part here, so you can fill it with one of the four sentences. And the last part is paragraph 3. You can put the blank or the sentences, one of the sentences into the blank part here. Okay, so after you read, you will get some information on or a depiction of what the patient-centered is. Hopefully, you can read it thoroughly, so you will get the clue what the patient-centered is. Okay, here the sentences that you need to put in the gaps. Just pick one for one gap. So you will have a one sentence left that cannot be used in any paragraphs like that. Okay, here, when you have read the paragraph, I believe you will get the information. Here is my summary after reading the paragraph. The assumption of the doctor. The patient-centered is related to the assumption of the doctor, whether the doctor has whether the doctor viewed the patient as a person who doesn't know who a person who doesn't know any information or any idea or doesn't have any knowledge about her or his disease, but actually the patient-centered viewed the patient itself as the one who is expert on the symptoms or the signs that or the disease that is suffering on him, like that. So patient is expert of his or her own disease. So if the patient is the expert of himself, means the doctor must interview the patient to know what actually happening on the patient. And then the second part that I can conclude from the three paragraphs is that the questions that asked by the doctor can show or can indicate whether the doctor used the patient-centered approach or not. Okay, later on I will tell or explain it on the next slides. Okay, so you need to pay attention on the questions that you created or you produced when you talk with your patients, because any words or any sentences or any questions that you ask to the patients can bring can show you whether you are the doctor who use patient-centered approach or not. So let's go to the next slide to get better information or clearer information related to the types of questions or the language that you use for indicating that you are a patient-centered doctor. Here, the question types, there are five. There are five questions that can be taken from the paragraphs. The first one is closed question, second one is open, and the third leading question, then multiple questions, and the last one is tag. So, in order to be viewed as a patient-centered approach doctor, you need to avoid the four questions and use one of them, that is open question. Okay, the first one is avoid closed question. Okay, and then leading question, also multiple and tag questions. Okay, let's to get the clearer informations, let's go to the next slide here. No. Okay, I thought I put the sample here, but it's okay if I do not put the samples of open or closed question. Here the closed question, I think I have explained it in the previous meeting, but it's okay, I re-explain it here. Closed question is the question that can drive the patient to answer yes or no, like that. If you create a question and then the patient is just say yes or no, means you just use a closed question. So closed question must be avoided because it limits the patient to express what he wants to say actually. And then the second one is open question. Of course, it is one of the suggested question. So if you ask question, just try to use this type of question. Open question is the question which answers is an explanation from the speaker, like that. If you ask question, are you hungry? Of course, the question will be answered with yes or no. That's the cross question. But if you ask question with a WH question, what, who, where, when, why, and how. It will drive the patient to answer it or to explain it, to describe more clearer about what you are asking about, like that. And then the third one is the leading. Okay, the leading is the question that you created. Actually, it is almost similar with the closed question, but the closed question is, the leading question is the question that you created to direct the patient to follow what's in your mind, like that. Take for example, the leading question is like this: did your son's allergy start after you bought the dog? It is a close question, and of course, it is a leading question too, because the doctor seems to know what actually allergy come from, but actually the patient hasn't told the information clearly to the doctor. So the doctor just direct the patient to have a similar assumption related to the disease or the symptoms. And then the fourth question is multiple. Multiple means more than one. So you ask the patient to answer the question, more than one questions. Like, is he getting this attacks while he's outside too? Do they come on suddenly with no warning? What typically happens? Some things like that. So the patients must answer three questions in one time. While answering one question sometimes is hard for the patient. The patient need to think or remember what has happened to him, something like that. So, bringing multiple questions in the interview will confuse the patient whether he wants to answer the first or the second question first, or whether he must answer different, not related answers to the question, like that. Okay, be careful. Multiple questions will confuse the patients to answer. The last one is tag. Question tag is like a confirmation whether it is correct or not, like that. The question tag is just a question that typically a confirmation, asking confirmation from the patients. It seems the doctor has a clue with the disease of the patient, and then he just want to have a confirmation from the patient, and then the interview can be finished with that. For example, the question is like this: and you've already taken him to see your general practitioner about this problem, haven't you? So the question haven't you is like, just a confirmation. So the patient will answer it with yes or no, like that. It is almost similar with the cross question, but the tag question, like I said before, it is just a tag confirmation. The other example is, so the symptoms are there all the time, are they? Okay. That's the sample of a question type. So remember, avoid closed, leading, multiple, and tag questions. Come to the next slide. It's about describing pain. So, as a patient-centered approach doctor, you must direct the patient, or encourage the patient to tell everything he knows or everything he experienced with the disease. So it means the patient will describe the pain with their own word. So if you are a medical doctor, you need to understand the common words, or I can say the non-medical terms words that is usually used by the patient to describe their pain. Take for example, if you have a headache, the patient may say it's a blinding pain, or if it is gastrics, they may say it's a burning. My stomach is like a burning, cramping, crushing, gripping, pounding, shooting, stabbing, tingling, throbbing kind of pain like that. So the patient may use various types of words that possibly is not listed in this 10 describing pain words. So try to find out the common words that is usually used by the patient to describe their pain. Okay, those are the 10. It's not limited until only for the 10, because the patient possibly creative with their own words, so they may use probably slang words or something. So try to understand your patients with their words. If you don't understand, you can ask clarification whether it is correct or not. Okay, try to find the meaning of each words on this 10 list. Then, still related with the describing pain, the patient may say or tell you, explain about their pain with uncommon sentences or phrases. They may use metaphors. It is like figurative language. Take for example, I felt like I'd been hit over the head with a hammer. My head feels like it's being clamped in a vice. Those two sentences, are the sentences that may appear on the may during the encounter or the interview between you and the patient, when they use the metaphor language. So if you don't understand the metaphors created by the patients, you can ask what actually the meaning of I felt like I'd been hit over the head with a hammer. So, okay, the next is clarification, facilitation, and repetition. It is very related with the previous part, that is on describing pain or using metaphor, because the patient may use the words or the phrases or the sentences that is not common for you. You rarely heard it because they use their daily words, and you are living in the medical sectors, and you probably use medical words. So here, to avoid misinterpretation, you better for you to have a clarification, indicating that you listening patient and pinpointing what you know and don't know. That's the point. And then beside that, as the patient-centered approach, you as the medical doctor should facilitate the patient to tell everything in his or her mind. So, facilitation is like encouraging the patient to say more, but not specifying the topic. Okay, why not specifying the topic? Because if you specify the topic, the patient will stop the information or stop telling the story to you. So the point is just keep encouraging. This can be done through posture, non-verbal, yeah, and then actions, still non-verbal, and by words on what you said. It can facilitate the patient to tell or to give you complete information. The third one is repetition. Repetition is echoing the patient's words, encourage him or her to give more details. Okay. This is useful for eliciting both facts and emotions like that. Repetitions, it means you said what the patient said. Like that. You just repeat what they said, but actually it is very useful. It can encourage them to give you more details. Okay, here are the examples. The first one is clarification. The example is, when you say this, do you mean like that? Just let me check what you have told me so far. Then blah 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 like that. And then the facilitation is, I see. When the patient told the story, you can say, I see, that's right, okay, I'm listening, please continue. Or you just nod your head. It is non-verbal. You nod your head to indicate you are listening him, like that. And then the repetition, the sample is this: the conversation between patient and doctor. The patient said, I was terrified. And then the doctor responds, terrified, like that, terrified, uh, with the right paralanguage. I mean, the tone and the volume and the emphasize terrified, to indicate you are curious on what the patient felt related to the disease or the sickness. Then here is the summary what you've learned. Okay, the first one is comprehend patient-centered approach to build communication. You need to comprehend the patient-centered approach because sometimes medical doctors just bring their own assumption in the interview so that the patients has no chance to express what they have experienced related to the sickness. So if you want to get more signs or symptoms from the patients, you can ask them. Um, you can ask them and try to dig the information deeply, and here the second type, the second point is that types of questions. There are five types of questions. There are four types that should be eliminated or you need to avoid, but there is one that is useful. That is the open questions. And then the third point is that understand what patients said from learning words related to pain description, because the patient has their own background knowledge on what they felt, and then they have experience on the symptoms they felt. You need to understand what the patient said. Even sometimes your patient may use metaphor, so it is sometimes difficult to understand what they said. So better for you to use a clarification and then keep facilitating them to tell their stories, and then using repetition is a sign that you are listening them when they are telling their stories to you. So that's all the information, the material for this video. You need to master it as the medical doctor in the future. Thank you very much.